everyone. Thanks everyone who joined. I'm sure there will be more people showing up. Thanks so much, and welcome. So let me just walk you through the agenda for this meeting. The meeting is, we have a really important topic to talk about today, and it's about the Global Fund grant revision process. And we have a very exciting lineup of speakers. And we really do manage to keep ourselves on time. So we have just 1 hour for all our conversations today. So today we're going to, of course, start with Judy, Executive Director of Input, to give us opening remarks. And we'll proceed with Pedro Garcia from Community Engagement Strategic Initiative, who will give us an overview of what the reprogramming process is and the opportunities for engagement. Then we'll move on to discuss how this works in Ukraine and what is the role of the community and people who use drugs in the grant revision process in Ukraine. And finally, we'll have our colleagues from Plan International Benin and Karan Awada, who will talk about experience and lessons learned from the grant revision process in his country. A few ground rules, just a quick overview. Please make sure to keep your microphones muted. The meeting is recorded. If you have any objections, let me know. Please post questions in the chat box, and we will definitely have 20-25 minutes in the end for the discussion. And in the end of our call, please don't leave too early. We will take a group photo for everyone. We have language interpretation available today for French and Russian. So please use the options in your in the bottom of your Zoom. And if you need to hear only the interpreted languages, click mute original audio. So, Judy, please, your opening remarks.
Thanks so much, Gaia, and welcome everyone to Input's Global Fund Reprogramming webinar. Really thank everybody for joining and showing interest. You know, to be honest, at the beginning, we were worried about low interest or turnout for this topic, but we know it is a very important one. But seems, you know, there's lower levels of awareness of, you know, what reprogramming is and what it means, and also, you know, understanding of why and how we as people who use drugs and representatives and networks should be, you know, spending time learning about it, and also, of course, building awareness about it. I mean, even from our side as TA providers, we're also still learning as we go along as well. And we've, you know, we haven't had the whole, I think, breadth of experience in providing TA on reprogramming. So in many ways, it's also, you know, a co-learning exercise for us. You know, as I can see from the participants on the call, I know we've already worked with many of you to influence Global Fund's GC7 and the funding requests. And it was through, you know, some of this process as well that we learnt about, you know, G6 and opportunities for GC6 reprogramming. And, you know, because of this process, you know, we learnt that there were, you know, opportunities to fund, say, population size estimates for people who use and inject drugs, piloting of needle and syringe programs, drop-in centers, and funding for advocacy for OAT. And this is, you know, something, you know, we just found out recently also. So because of this, you know, we realized there's this whole other, you know, I guess, box of possibilities that, you know, can occur throughout the grant cycle that, you know, up till now we had been, you know, missing out on. So as we all know, even though the Global Fund's the largest funder of harm reduction programs, the share of the pie is still small compared to, you know, the need. You know, there's still a lot of, as we are all very much aware, you know, significant inequity in the funding allocations. So I think we, as drug user-led, key population-led networks, you know, we always are trying to keep our eye out for every single opportunity and every lever that we can use and really learn, how to prize it open. And Global Fund reprogramming is basically an area that we haven't used to its full capacity up to this point. So, really excited to also be learning along with you all today. Very grateful to the speakers who've taken time out their busy schedules, Pedro, Oleg, and Karen, and really, looking forward to the breadth of knowledge and experiences they have in how to use this lever and use it to our benefit, and really be able to, use this to drive meeting the critical needs of our community, and also, working out how to address, the imbalances that we see in resourcing. And just finally, thank you very much, Gaia and Chantal, for pulling this webinar together, and of course to the translators as well.
Thank you so much, Judy. Great really to hear and to open the conversation, a very important conversation for our webinar. So I will, without further delay, pass the floor to Pedro. Pedro is our focal point and technical advisor from the Community Engagement Strategic Initiative, and he will walk us through what actually reprogramming is, because everyone really wants to know. This is a very mysterious process for a lot of people. Welcome, Pedro. You prefer that I project your slides, right? Okay, let me open.
If you can, Gaia, that'd be great.
Yes, let me just...
So while you set them up, thank you, everyone. I'm very glad to be here. Thank you, Input, for organizing the other speakers that will be talking today, and thank you, everyone, for joining. It's great that Input is proposing this learning exercise, as Julie was calling it. And this is also a learning exercise for us at the Global Fund, and trying to unpack some of the ways in which communities can engage in grant revisions. So I will be speaking briefly on 3 different points. Guy, if you can go to the agenda, yes. One on the minimum expectations for community engagement, an overview of unpacking of this grant revision, the types and the processes, without drowning you too much on this, but just to give you an overview of what grant revisions are. And I think we cannot talk about grant revisions without discussing the PAR and EQT funding. So in a few minutes, we'll see what that is. And today I'm joined by some colleagues from the Grant Management Division and from the Community Rights and Gender Department as well. And they will stay for the discussion to hear from you on engaging around grant revisions and reprogramming. On the minimum expectations, just to situate the discussion on community engagement around grant revisions in the larger discussion around community engagement, if you can go to the next slide, Gaia, around community engagement throughout the grant lifecycle process. There have been different assessments that have shown that the community engagement across the grant lifecycle is variable, but there have been weaknesses more pronounced during grant making and around the implementation oversight. So unlike the applying for community engagement in applying for funding, some more weaknesses actually when implementing. So engaging in grant revision sits within this community engagement around implementation oversight. Next slide. There are 3 new minimum expectations around community engagement, and the first 2 I will not go into detail because the first 2 are more linked to grant making and applying for funding. But the third one is very relevant around grant revisions. And it's the minimum expectation that community and civil society representatives on the CCM will have timely access to information on program implementation. And this can translate, for example, on pre and post CCM meetings and support for the CCM to meet with their constituencies and provide the information also that they need. Next slide. So what are grant revisions? Some of the types and processes. So grant revisions, basically, next slide, it relates to the process in which global fund investments can be adjusted due to changing context or changing requirements during grant implementation. Grant revisions, as you see on your right, is part of the grant lifecycle, a crucial part. Revisions are initiated. So the process of grant revision is initiated in discussion between the PRs and the country teams. And depending on the revision type, as we will see just in a few minutes. And revisions are important because they ensure that the investment of Global Fund are as effective and efficient as possible to achieve maximum impact. So if you go to the next slide, an overview on the grant revision, the types of revisions, and perhaps just for the interest of today's discussion, focus on the three in the middle. So there are revisions when there's additional funding. So when there is an increase or reduce or a transfer of grant funds. There is a grant revision when there are adjustments to the scope or the scale of the grant through changes to modules, interventions, or targets in the performance framework. That is called the programmatic revision. And lastly, a budget revision. That is when there is reallocation of funds across the modules, interventions, or cost categories of the grant. But there is no change to the performance framework. So that's the difference between the programmatic and the budget one. Just to say that the revisions are a relatively heavy process in the Global Fund. So there is some flexibility or some thresholds in terms of what principal recipients can do when reallocating funds. So depending on the portfolio, if the portfolio is classified as high impact or as core or as focused, then there are different thresholds around the 15% that determine whether a revision is material or not. And if it is material, then it needs to go through this revision process. And if it's not material, then it doesn't have to go through this revision process. Next slide. So from this slide, without going through too much of the process, just to note that that CCM endorsement is only required when there is an end date revision, an additional funding revision, or a programmatic revision. So as I said, programmatic more in line to changes in the performance framework, in the targets, in the scope, in new interventions. So a budget revision would not require CCM endorsement. Next slide. How can communities engage in grant revisions? And this is definitely not a to-do list. This is more some bullet points of what we have seen that works in terms of community engagement in grant revisions. And we're also looking forward to hear from you what works and what doesn't work. So it's important that communities at civil society, they know which PR and which SR is responsible for which intervention and for which activity in the grant. This will allow actors to engage better during grant implementation. So some ways that I would like to highlight today is working with other constituencies and other community organizations to develop collective discussion points and then raise them with PRs, with SRs, with fund portfolio managers, with country teams during country missions, etc. Setting up regular engagement touch points with the PRs and SRs and having clear accountability and communication channels. Ensuring that the CCM community representative is sitting on the CCM oversight committee and leveraging new findings or assessments that highlight gaps in grant implementation. So for example, through community-led monitoring and highlighting the needs to evolve or improve the existing program delivery. Next slide. I put up some publicly available resources, operational policy notes, procedures, grant budgeting guidelines that go through some of the thresholds and some of the points that I mentioned just now that you can consult. Next slide. Important to discuss unfunded quality demand. Unfunded quality demand is demand that was classified as above allocation request, so PAR, prioritized above allocation request, that was already reviewed by the technical review panel. And the technical review panel deemed that those interventions were technically sound and strategically focused. So this list of interventions, there's a register that is continuously updated and available online. And you have the link that keeps track of this UQD. It's important to note UQD, out of the recommended UQD of around 6 billion in GC7, nearly 1 billion has already been funded through efficiencies during grant making. And this relates to a comment or a concern that has been raised by the TRP that has seen higher program management costs that come in funding requests, and many interventions around equity, around human rights that are in the PAR. So it's important to be aware of what the UQD includes that has already been reviewed by the TRP, but it's not yet in the grants. Next slide. A couple of ways in which UQD is funded. The main one, the vast majority of UQD is funded through savings and efficiencies during grant implementation, where countries bring interventions from the UQD into the main grants. And other sources of funding for UQD include portfolio optimization, so top-ups, new funding, debt swaps, or non-global fund sources like private sector and ministries of health, etc. And a last slide on community engagement in UQD funding. So again, important to hear from you what has worked, what has not worked in your context, but a couple of things that we have seen that have worked. Being aware of the UQD register, reviewing and prioritizing specific budget lines that you advocate for funding. In CCM meetings, when the PRs are presenting updates on their budget execution, pay attention to report savings. And this is a chance for advocating for your UQD priorities. Approaching private sector foundations and other technical assistance programs and non-global fund sources, and propose UQD priorities. And have a discussion with your country's debtors for a debt to health debt swap discussion. And looking forward to hear from you what other ways of community engagement have worked in grant revisions and UQD funding. Thank you very much, Gaia.
Thank you so much, Pedro. A lot of information. I think probably all our participants would agree that it's a lot to digest, but please rest assured, everybody, that we will distribute the slides. Pedro will also hopefully stay with us until for the discussion. So please make sure to ask your questions in the chat box, and we can try to answer them either during the conversation or after during the Q&A. So now I will pass the floor to our second speaker, Oleg Tymoretsky. Oleg, are you here with us? I don't know whether Oleg is here. Oleg is here. Oleg, ты нас слышишь?
Oleg, can you hear us? Can I speak, Gaia? Can I now speak?
Одну секундочку, да, Олег.
1 second, yes.
Director of the National Ukrainian Network of People Who Use Drugs, and he will share his insights and experience from the community perspective of how it worked in Ukraine, and just give an overview of the process and challenges and the role of the community. Oleg, you can proceed. Да, ты можешь говорить.
Друзья, добрый день.
Hello, dear friends. I am very happy to participate in this meeting, though it's very challenging time now, and I would like to share the role of the public sector and the organizations which represent community in the processes of formation request within Global Fund and funding. Our work experience in these processes since 2017, and for the participants, it will be clear why I started being involved in 2017. Because in 2017, when Ukraine was forming a request to Global Fund for 2018 and 20, for the first time, based on the statement of the organizations representing communities, including people living with HIV, so the process of submitting the application was which was the country priority, it was suspended. So the request was to completely review the Global Fund application. Indeed, the process in the country was not quite calm, with main recipients identification, with the oversight of the process by national coordination mechanism, including the Coordinational Council on TB, HIV, and AIDS. And for the first time, the community stated that application requires complete revision, but not automatic extension. And indeed, after that, certain priorities were defined, which corresponded to the Global Fund block for Ukraine, which was called support of national networks of people using drugs as part of mobilization. Then there was the next stage, the next round of Global Fund for 2021-2023. Let me remind you, it was the time when the whole world encountered challenges of COVID, and at that time the country received two possible funding. It was the direction of COVID, and the main grant, it's $130 million for Ukraine for 3 years, from 2021 to 2023. Accordingly, there was a round which is currently now underway, 2024-2026. But now let me share another experience which is not much different. Indeed, we have a coordination council in the country. It forms technical expert group. Indeed, the community is part of these processes. Indeed, I can say they participate, but my further presentation will be focused on the impact and whether it is sufficient of the public center organizations which represent communities for priorities of global funding. And the response from my side, there is engagement, but it's not sufficient. And why? Let me give you a couple of examples of forming the next application for 2024-26, and the organizations who represent the community. We have 9 organizations in Ukraine which signed the statement of appeal due to the low assessment of the technical group, which put to zero the efforts on funding, because in Ukraine, in addition to COVID challenges, large-scale war started, and the communities has very scarce funding, and they could not make a decision without resolving some other issues. We had to main the decision from main recipients who were agreeing these processes, etc. The community approached the Global Fund, the country team. We applied to the national coordination mechanism with a statement that this application would not be supported by community organizations because the priorities were annihilated. So it's a very vivid example, a very great difference. For 4 months, the community were working with the experts provided by global funds, considering all the recommendations like monitoring, community-led monitoring, supporting national networks, war-related support, critical infrastructure support, but it did not imply sufficient funding or some funding at all. And my words can be confirmed by practical solution. The interventions that were approved by the National Council as critical were decreased by 50%, and critical infrastructure was justified. And as of now, due to the challenges that have not been resolved, we have a risk of underfunding for 6 years. Not spent money we can receive to the main recipient, and the main recipient will bridge the gaps existing in the country. So the community will be deprived of some existing funds. So the role of community is there, but the impact process is very limited, and it's impossible to impact these processes. Though in Ukraine there is such experience which I haven't seen in other countries, and I believe it is successful experience. We were able to apply to the Global Fund, and they supported part of the organizations and national networks of community who implemented the Global Fund for 2020 funding 24-26 as a responsible partner. Direct line, there is guaranteed funding, which allows doing certain activities to achieve common goal that the country believes to be the global one. But at the same time, there are great risks, and I would like to request Gaia to share the example of the letter when implementing the new grant for 2024-26 with the Global Fund. We hear statements that the Ukraine does not have sufficient funding and all the savings will be revisited and spent for the medication purchase, which is necessary to support other critical infrastructure, etc. I would like to say the community tries to impact that, and what we have done, we have shown that there is power which is not funded in Ukraine, but confirmed by Global Fund as necessary funding to achieve strategic goals. We have informed main country recipients that the community would not be fully funded, underfunded in the critical infrastructure, and strategic objectives will not be implemented. Because of that, we hope a lot that our voice will be supported and such risks as taking funds by more serious actors through discussing additional evidence corresponding to the cascade of services, the community so the approach to the funding of community should be revisited, because communities will never have evidence base which will be sufficient for the government or ministries or representatives. It will never be included in the cascade of services, because currently the National Health Service, which guarantees medical service, the social sphere in Ukraine is not funded at all. And such projects as Global Fund, PFAR, and other large actors provide funds to fund such things to achieve global advocacy goals in TB, HIV, AIDS in countries. That is why we hope that in October, when there is large conference of donor organizations, the community once again will confirm that funding critical infrastructure is important. To provide direct funding and consider responsible partners is critical, because the interventions that communities are doing cannot be funded with leftover funds. Currently, the community is funded less than 1% from the amount of grant. It should not be so. If we are full-fledged equal partners, and if we are indeed, and if the public is the necessary component of achieving all the tasks, it should have resources. I believe I have not disappointed many of you. Thank you very much for giving the chance to share this experience. I will be happy to answer your questions if participants have them. Thank you. Thank you, Oleg. I'm sure there will be questions.
Really amazing that you joined us from Ukraine. Slava Ukraine. Thank you so much. We will now move to our last speaker, and we will give
Героям
the floor.
слава.
Glory to the heroes.
Give the floor to our last speaker, and then we will hopefully have at least 20 minutes. Thank you all for waiting, but please post the questions. I saw at least one very important one from Mick already. We will definitely answer that. you can go ahead and continue posting your questions in the chat. We're moving to our speaker from Benin, Karen. Karen, can you hear us?
Oui, Gaïa, je vous entends très bien.
Yes, Gaia, I can hear you just fine.
Merci, Karen. So,
Thank you
Karen,
very much, Karen.
please use your translation options if you need to hear Karen in English or in Russian. So he will share the perspective from Plan International Benin, which is the PR of the Global Fund. So please go ahead, Karen, sorry. Merci.
Merci beaucoup, Gaïa.
Thank you very much, Gaia. As you already said, my name is Karan Awada and I am a doctor. I am specialized in health and partnerships with a Global Fund here with Plan International in Benin. We are working in a project that works on prevention of HIV contamination. And I've been doing this for roughly 10 years. And we try to take into consideration in our work who are the key beneficiaries, who are the key populations, and to try to work with drug users so that they are protected and have access to good quality information. So my presentation today will talk about my experience with programmation, how we've worked with the community, and speak about the different drug users, whether it is injected or orally taken drugs. So I am going to have a brief presentation of the agenda. So what we're going to talk about the organization, and then pass and talk about the justifications we use for grant revision. Then we're going to talk about the process and the approach to the grant revision. And finally, give examples of interventions integrated into reprogramming, mostly addressing drug-using communities here and how we introduce this perspective in our program, which is something that wasn't originally there. So Plan International Benin is an international NGO that is represented in 78 countries throughout the world, in which we also find Benin. And as such, we work on the advance of the rights of adolescent girls, young women, and more generally children. We aim and we strive to achieve gender equality. And right now, in this Global Fund cycle, we are the principal recipient of the C19 RM funding and the HIV grant. The HIV grant has a budget of 7 million, and we have, of course, as I said, integrated drug users into the key populations we're aiming. So, as stated, we have a 7,317,000 euros. Our budget will cover the period stretching from 2024 to 2025, and we also have a contribution from Plan Canada. It's a matching fund of 610,000 euros. So all this will aim to construct a network in the community and try to address drug users through key animators that we call the pair animators, and have them be nexus or focal points, and try to talk with drug users about the different risks they face, to talk with current users. These animators, these pairs used to use themselves. So we want to cover that in a national uh, sense, and we have right now over 65 of them. So how did we justify these reprogramming to the Global Fund? So at the end of our reporting period, which is usually done semesterally, when we talk about what we've done, the objectives we've achieved, the results we've obtained, we were able to have uh, a perspective of what has been done. And then we were able to see if we obtained the results we wanted. And of course, you will be able to see if there are gaps, if there's financial gaps as well, and what do you have to do. And when we looked at it, and when we do that, we see if some funding hasn't been fully used, if economies have been made, as was stated before. So we try to see how we can address this, or if not, how this sum can be used for other aims, and try to see what can be done. And that's how we integrated the drug using community in order to finance actions that were able to help them. And then we were able to change our programmatic objectives and include these populations in that in order to improve the quality of our intervention. So there is a network of injected drug users in the country, which is followed on by the Benin Plan International uh, uh, Bureau. This organization is called Borns. You can see it in the screen, and they have everything they need. So we tried to have an analysis based on the performance of the results and the set objectives in order to put in place a risk reduction program in order to have injection kits that are sanitized and ask them to do some reporting. So we have rich data of what they're doing. We analyze our objectives that we've set with them, that we've contractually uh, set up with them, and try to see how the drug using community responds to these initiatives. We then look at indicators and how or what can be bettered. If we can see that in the semester or in the year there are clear weaknesses in indicators, we try to reinforce these activities or augment the number of things that are led in order to respect our own objectives. So we how can you do this? What is a winning strategy? You have to do this as often as possible. This has to be a continued effort. So in order that you can, in a way, see in the future, make a prediction, and try to structure your uh, interventions to profit of what you do well and help what you haven't reached. And we did this, and we found that the drug using community that used injectable drugs was one of the key populations that needed um, an additional boost and to element our own data and have a more impactful intervention. So that's what we did. Some examples of interventions that we did during the Global Fund reprogramming and that were accepted. One of the examples could be our strategy of guided referencing. So when we have our pair animators, when they try to talk with drug users and promote how they can test themselves or increase their awareness on doing this and how they can have access to their HIV testing in their localities, they try to direct these people to allied centers in which this can be done. And that person can then be followed up upon. And we saw that this had a huge positive impact. But the problem that we found is that the people couldn't go to the hospitals to get the treatment. So they did get tested, but they didn't get treatment. So what we did is that in order to address this problem, we tried to help these persons by using our referencing, our pairs to take them there. And in order to have this, we tried to allocate a new fund so that the animators can pay for this transport of the drug using communities to the hospitals so they can have access to treatment. Another idea that we had is to increase the allocation that was given to the injection kits. And we based this on a needs assessment that we did. We saw that the quantities were not enough, so we raised them and allowed them to improve the number of kits that were available. And finally, we tried to strengthen the CEPIAC, which is in French, the Center of Addiction Treatment here in Cotonou. Cotonou is a city here in Benin. So what we did is that we wanted to help them, and we had funding from the Global Fund in order to finance a coordination unit who is at the center itself that coordinates and is a secretary to that takes account the needs of the organization, and then we increased the motivation of facilitators so that they were more keen on sensitizing and doing incidents with the different communities. And we tried to introduce entertainment activities so that people were eager to come, to have more engagement, and to build loyalty. Our facilitators are motivated by a small stipend so that they can come and work this. I want to stress the success we found with having entertainment activities because people really can be afraid of coming. Some drug users were not very motivated to go because they had to go there and then go back to some of the ghettos or the hard parts of the city. So we tried to have welcoming spaces so that people wanted to stay in the center, so that they felt comfortable and they could be supported during this time. So this is a couple of examples we have of successful experiences here in Benin Plan International. I want to stress the importance that you have to stress the relationship with the different communities. Thank you very much, Karen. Your intervention was very interesting. Your present.
And we now have 15 minutes for the questions. I saw at least 3 now in the Q&A, and I think the 2 first ones are most probably addressed to the Global Fund, Pedro, and his colleagues. And so shall we start with that, unless I see any raised hands? Perhaps we can start with that one. So the first question from Nick is whether the Global Fund actually always had decent policies, including reprogramming, but the question is not so much what we as drug users and key populations do, but what will the Global Fund teams do to ensure that opportunities are available and policies and procedures are implemented for criminalized populations? And also, in addition to that, the FPMs and country teams need to work more with governments to promote the value of community comments and observations. Pedro, would you like to answer that, please?
Thank you, Gaia. Thank you so much for the question. So what can the Global Fund do? I think I'll just go back to the minimum expectations, and particularly the expectation 3, because I think that this element of information sharing and of ensuring that the CCM and the community representatives that sit within the CCM have access to timely information. I think this is the first key step that the Global Fund can do and is trying to do to ensure that there's engagement including from criminalized populations. Engaging with the CCM, so as the communities are invited to engage with country teams during country missions, Global Fund teams are also expected, encouraged to meet, engage with the CCM whenever whenever they travel to the country or whenever or being in communication and engagement on a constant basis. Engaging also with civil society besides Global Fund implementers, also during country missions and beyond, to have this conversation exactly to try to identify when some of these policies that are in place, that are mentioned, that are good policies in place, but are not being implemented. So try and identify some of these gaps and challenges in policy implementation. And I think the last one around around that comment on promoting the value of community work, I think that's also something that the Global Fund is doing and can do and should do more, of course. I wanted also to mention, perhaps as a particular example, and Matteo, if you're online, maybe you can speak a bit more on the Global Fund engaging following the passing of the anti-homosexuality bill in Uganda. Matteo, if you're online, if you want to talk a bit more about that.
Can you hear me?
Yes, we can.
Yes, apologies. I can't turn the camera on as I'm in a not in a private room, but yeah, maybe from just my perspective, you know, I think the Uganda example could be a fitting one in this particular case, and it refers back to this is GC6, so we're looking at 2023 in this particular case, and at the period last spring, basically the spring of 2023, when the Parliament of Uganda was getting ready to sign into law. Well, they approved the Anti-Homosexuality Act bill, and then it was, you know, we were waiting for it to become an actual act. In that period, society organizations, particularly key population-led organizations, got together with you know, the SRs and the SRs with the PR to start, you know, proposing a number of changes, right, to the grants that were that TASO, you know, the PR2 in this particular case, principal recipient was implementing, which led to a, you know, reprogramming request, a revision request, a non-material revision in this particular case, which was made, you know, using savings that existed already in the grant and within the same grant, the TASO grant. And yeah, I mean, you know, it was actually, in that particular case, I thought it was quite you know, a good process in the sense that more than 40 organizations got together to identify their needs, to identify, you know, some, you know, work plans and activities that they needed, as well as, you know, develop budgets. Of course, you know, then the request in the end was much higher. I think the total request came up to, considering everything, also the Ministry of Health drop-in centers, the request went up to 1.4 million. But then, you know, savings were insufficient to cater for the entire amount. What happened in that particular case, I think that about $900,000 that were, you know, reprogrammed as a result of this exercise, in quite a, you know, I would say global fund. You know, for those who understand the global fund timing, you know, I think it happened in the turn of 2-3 months maximum, which in this particular case I thought was quite, you know, although it took time, right? But I thought it was, you know, in the end, there was a good result. So maybe I can stop here. I don't know if that's maybe a fitting, you know, example, but I hope that maybe in a way it is. Thank you.
Thank you so much to both Matteo and to Pedro. So we have 2 raised hands. I will just answer one last question from Mick that is addressed to Karen. So Karen, as a PR, does Plan Benin provide funding to drug user-led organizations? If not, why not? Can you please answer that, Karen?
Ok, merci beaucoup.
Okay. Well, thank you very much, Mick, for your question. So, is Plan in Benin going to give budget to drug-using organizations? The quick answer is yes, but I'm going to have to talk a little more, give you more meat to that answer. So, we are striving for higher integration. And what we're doing right now is trying to work with the methadone that is giving in the centers. We're working with centers, as I said, and try to help people to have access to treatment. What we're doing is that we're working with Plan and the Ministry of Health here in Benin in order to rehabilitate the centers. Plan International in Benin started this rehabilitation and is essentially handling it as a pilot. Plan International as a whole is contributing a lot to what we're doing, to our activities, and we're completing financing in order to have a more global care facility. Thank you.
Merci, Karen. Mick, does it answer?
Just on that question,
Sure,
that
sure.
wasn't, you didn't really answer the question, Karen, because My question was, as a PR, are you funding drug user-led organizations to be implementers? That was my question. And it sounded like you weren't.
Ok, d'accord, d'accord.
Okay, okay. Well, you made it clear. So we finance directly drug using organizations. That's why I talked about the BORNS organization, which is an organization that is led by drug users with whom we have been working. And generally, with the Global Fund, we have a contract and objectives. So we have a budget and results that are expected in order to address directly the organizations that are led by drug users, and they are accompanied by plan as well. Thank you.
All right, so now we can proceed to Robin. Robin, please go ahead.
Thanks so much, Gaia. Thanks, everybody. I guess a two-pronged question that is linked. So perhaps if we could hear from the Global Fund, specific examples of how communities of people who use drugs are able to access funding to be able to support their engagement in the reprogramming activities and consultations around country team visits. That would be really, really helpful. And linked to that, there are experiences out there, particularly in communities of people who use drugs, who have been very engaged in the funding request development process, but have never received the final budgets for approved activities as negotiated, which makes it really an unequal playing field from the very beginning when we're talking about community engagement. So, just if you could review what resources are available for communities to tap into to be able to engage meaningfully in these reprogramming processes, how to get access to these critical documents because they're not coming from the places where they're supposed to be coming from. How can communities be on top of when country teams are actually going to be in the country so that there is carved out time for meaningful engagement and dialogue? Thanks so much.
Thank you so much, Robin. Really great question, and also a few inputs, also great. Someone from the Global Fund wants to answer that, or Pedro?
Hi, Gaia. Hi, everyone.
Hi.
I'm happy to make a start on this question, and thanks so much, Robin. Just speaking briefly to some opportunities on how to mobilize funding to prepare engagement across the grant cycle, including in revision processes. One option is through short-term technical assistance that is available through the strategic initiative. I will put a link in the chat in a moment. We can support, for instance, convening of people who use drugs or inject drugs at specific moments in time. For instance, I think now is a good moment since countries have submitted their funding requests and grants. Many grants have gone through grant making to actually look at what ended up in the final grant, what is in the UQD, and how you want to structure your advocacy around that, so that for the moment that revisions are coming up or are there any savings, there is a good prepared and kind of costed list of activities that you want to advocate for. So there is an opportunity to request support for a facilitator for this process, but also some support, for instance, to fund a workshop. I just wanted also to speak a little bit to your second point, because I think it relates a little bit around to this point also around how can organizations become implementers. And I just also want to mention, and many of you know, that there are other bilateral partners providing technical assistance, some of them also in the area of organizational strengthening. So maybe that's also interesting for some more nascent networks. And I can put some more stuff in the chat, but also I want to mention the 6 regional networks that the Community Engagement Strategic Initiative is supporting, and they have a specific mandate about actually linking up community members to channels of support that can, fit with their need, not only the SI, but also beyond. So if there is anything specific, any gap you have identified around engagement in Global Fund and related processes, you can reach out to the regional learning hubs or through Gaia or to us, and we can brainstorm some solutions. Now, the other point about accessing documents, I would still say that the number one is really the CCM representative to get these documents and to make sure that there's a good plan in place in terms of feedback mechanisms between the representative and the broader constituency. And I think this is one of the key aspects. And if there is not a dedicated seat for people who use drugs, then with other building relationships with other representatives in the CCM. I just wanted to also to share a thought. I think given we will share the slides, but I think since there is also so rich experience in this group, maybe it could also be an opportunity to bring together some of the examples around what has worked to engage in grant provisions and put it in some document that we can share more broadly, because I think these experience, particularly around what has worked, what hasn't worked, are super, super important to share. So over to you, Gaia.
Absolutely agree. I think we might not, unfortunately, have time to gather all the countries' experiences. I see that people are putting information in the chat box, and we're running out of time, but I definitely want to make sure that Anton Vasyenka has a word. He has his hand raised for a while. Anton, please. No, we don't hear you very well, I think. No,
and now?
Yes, perfect. Yes.
Okay.
And maybe also you could there is a question from Francis about
it's my
there's a question also from Francis about examples from Ukraine.
Yeah, I see. Yeah. Actually, I think I can. Yeah, from women, about women who use drugs. Yeah, very relevant question. That's true. I mean, Ukraine can say that we are very on a good track with this, because in 2018, after Ukrainian network of people who use drugs were established, and that's why Oleg mentioned in his presentation, 2017 is a very special year in the history of development of communities in Ukraine and our engagement in Global Fund processes. In the next year, 2018, actually, the network of women who use drugs has been established, like organized, structured. And since then, I mean, later the representative joined one of the CCM committees, and now the representative is alternate of so we have member of CCM and an alternate. So alternate in this couple always one should be a women representative. So yes, we have influence on they can influence the processes equally to representative of network. But the thing is that, first of all, I mean, I want to maybe reflect and summarize speakers here, not just to add to what Alex said. For that, things like short-term consultancy by time framework will be suitable for reprogramming. You know, we all know well that for when granting process for the next cycle is happening, it works because at least community organizations has enough time to submit for this technical support, no matter it's short-term, long-term, and then receive some kind of a tech support. I don't know, whether budget calculations or whatever. When it's reprogramming, usually we see that letters to CCM from Global Fund coming with a very limited term, and it's really difficult to properly, organize all processes in time to have a really concise, organized feedback, especially to ask for technical support, to receive it, all the formalities, etc. But nevertheless, my point is here that it very much depends on how CCM is looking in your country. We hear here that you should have a seat and you should have access to information. But from practice, unfortunately, we see that it's not the only conditions to be, successful in the real influence on decision making. Because one thing is when when your CCM is a permanent advisory body as a part of the cabinet of ministers structure, as it is in Ukraine, right? Another thing when it's like a sub-working group somewhere under Ministry of Health, and after all these, wide consultations, final decision is made by, 3-4 persons somewhere on top separately, and so that's the thing. Also, I think Ukraine is in emergency context because of the war, and of course our successes, which we always say in the collaboration with government, because it's a specific case. Ukraine has 3 principal recipients, 2 from civil society and 1 is a governmental institution. So by definition, working together and sitting together in the CCM, we already doing work together, and key condition is that they really stopped considering us as the only troublemakers, but also really as the partners, and who can really propose solutions and work together. That's also important condition, and also that I think it's very important to go deeper into such things like UQD, PPR, because it's really that areas where principal recipients are very much experienced, in understanding and playing with these terms and with these things when we're writing the grants together. But for instance, this last case. When there was created technical expert group, and then split into 2 parts. One where all the communities been represented was just a group who proposing something, and then with another group who should score all the propositions, and there was only 1 representative of communities. It was only myself. All other 12 or 13 members who were scoring all the proposed was not from community, and of course their priorities are different. So the thing is that as a compromise, of course, number of activities which has been proposed then were moved to PAR, but then it's a question how you can advocate that when it's coming to using the unfunded unspent grants, really to fund that community proposed activities which went to PAR, and I think that is a weak place, because not so experienced people in all these global fund terminology and all these processes, and that's what we see exactly in the processes of grant writing, or especially reprogramming. But good news for us that since 2017 the budget and direct funding of community in Ukraine of people who use drugs is only increasing. For first say that 1%, which Oleg mentioned, it's a 1% specifically funding, which is a grant for organizational institutional development of the network and of the community. So it's not like all services for people who use drugs. Of course, there are much more funds, but 1% is simply that funding which we operate as Ukrainian network. And here we, of course, trying to advocate for more. But war and this emergency context, unfortunately, bringing another challenges, and it's really difficult to to advocate in a usual way when hundreds of healthcare facilities are destroyed, including those where we receive substitution therapy, and the really government asking for more funding, for instance, for some infrastructural things. So yeah, or for some medications. So it's just objective reality. But this is, I think, only our unique case. So my wish is to really have another webinar of this type, because this is really a good discussion. Sorry for being long.
Thank you so much, Anton. Yeah, I see that Mick has his hand raised. There is just one question to our colleagues from Benin as well. So if I think Karen has left, but there is his colleague Sylvain, who perhaps could also answer the question about any specific responses related to women who use drugs, and in addressing the specific needs that just go beyond only harm reduction service components. And also there is a question as well in the chat about I think just explaining a little bit more what the entertainment activities are, but perhaps maybe if you could quickly answer the question about women who use drugs, that would be great. And then we will give the floor to Mick and we will wrap it up because we're running out of time. Thank you so much to everyone who's staying. Thank you. Sylvain, est-ce que vous pouvez répondre?
Oui, Gaël, bonjour. Est-ce que c'est possible de me reprendre la question un peu en français?
Yes, thank you. Can you repeat the question in French? Yes, of course.
Je disais, est-ce que vous pouvez reprendre un peu la
Can
question
you
en
please
français?
repeat the question in French, please?
Alors, la question,
So yes, the question is, we just would like to know more about women that use drugs, that are drug users, specifically in your context, and also talk to us if you work with this population and what do you do, and what have you done with Plan International in Benin. Thank you very much, Gaia. Thank you, everybody. So our general target of the population we have is as wide as possible. So we work with women and men. The Global Fund project and the funding that we have and the different activities we have try to address a large array of populations. Of course, we have included a gender perspective so that we try to give care, specific care tailored to women's needs that are different to men's. We have not excluded women in any of our activities, but I have to be realistic and tell you that there is less women that are included in our groups with the different actors with whom we work. And we're trying to maybe find a way to reach them and also look of other funding avenues so that we have a more specific activity led towards engaging women. Thank you. Thank you very much, Sylvain. And
Mick, you have your hand raised.
Okay, thank you. I'm going to try and end on a positive, unusually for me, but I do think reprogramming and the whole process of reprogramming offers all of us, both the Global Fund and people who use and inject drugs and other key populations, an opportunity to work much more close together to ensure that the contribution about service gaps, about service quality, about the need to reprogram and refocus grant activities coming from people who inject drugs and from other key populations. Because even when we use the systems that the Global Fund has in place, good systems, I'm not criticizing those, once it gets to the point of it's no use us understanding the systems and being part of the systems if our opinions and our knowledge is not being taken seriously. And that is the case in most instances, not all, but in most. And I think reprogramming does offer an opportunity to work closely with DRG, with the grant management teams and people who inject and use drugs to actually get our opinions valued and acted upon and not just follow the processes. Thanks.
Thank you so much, Mick, and great that we're wrapping it up on a positive note. So for those who are still here, just to take a quick picture and to remember that, you know, we have a voice. And we will continue raising our voices and making sure that, you know, we are a part of all the global fund processes, including reprogramming.